Hi, welcome to this episode of Personal Finance Podcast for Doctors. We have yet another interesting conversation lined up for you with a real life hero, a well known and respected pediatric orthopedic surgeon, an environmentalist, a farmer, a teacher, and a philanthropist. He has many sides to himself. He lived a life of a normal doctor's life till his life turned upside down in a car accident. From no hope to a flourishing life. It is a story of grit, determination, and passion. And so let's hear it from the man himself. Welcome, Dr. Taral Nagda. It's so good to have you here.
My pleasure to be here.
So, Dr. Nagda, tell me, what inspired you to pursue a career in medicine? Was it that you came from a family of doctors and that was what your childhood was all about?
Not really. Nobody in my family was a doctor. And actually, medicine was not my first choice. I wanted to be an engineer. And I was preparing for IIT. But my mother told me that we need a doctor in family and take medicine. And I just followed her advice. So no inspiration. But it was Matroshi who told me to take up medicine.
तो बस माँ ने बोला तो कर लिया. And then why pediatric orthopedics?
So it's very simple. I didn't understand it that time, but looking back, I understand it very well. That my mind was for mechanics, physics, and I was interested in building things. So naturally, medicine took me to orthopedics. But at the same time, I was interested in humanity, meeting people, having fun, being creative. And that is what I saw in children. So finally, everything came together. The medicine, love for children, and engineering, it all came together in pediatric orthopedics.
You're so blessed, right? To finally have found a way without knowing into the field that you always were made for, maybe.
Suppose so, but retrospectively thinking, I feel that dealing with children and dealing with young parents, it's very inspiring. For a pediatric orthopedic surgeon, from the time we start, you advance in age, we grow older, but the age of the patients we treat always remains very young, and that keeps you young and inspiring.
Correct. And tell me, what was your childhood like? Because I believe from humble beginnings to a high profile career. So, how was that journey?
My childhood, I would say, was very multicolored childhood. I grew up, just behind Lalbagh Karaja. Uh, I remember that we were staying in a chawl called Saraswati Nivas. It was in the heart of Lalbagh where all the activities happen. So we've seen it all, Ganpati is being built, the procession, the loud music, the cinema on the road during the festivals, Dahi Handi. I've also seen gang wars and murders happening on the street as a child. But what really, was encouraging the whole chawl living as one family, Vasudeva Kutum. There was one phone in among 20 rooms, and any phone would come and people would call us. There was one television for so many people, and everyone lived like a family. So that was something which I learned a lot of things, growing in a family of 20 families.
Oh, you were 20 people together living.
No, there were 20 chawl rooms, and we could go and live in any with any family. It was like that.
And to today, where you have people who live in one floor, in one building, no connection with neighbors. How does it feel to be wherever you are today?
So I don't think I have changed as a person. As a person, you remain same. Your surroundings may change, but whom you are as a person will never change. Your roots will never change. So for a tree is known by the roots, not by the leaves or how tall the tree grows. If the tree doesn't grow tall, it's okay. But if the roots are not proper, not strong, then the tree loses the identity. Though we recognize a tree by the trunk, leaves, and the flowers, but what is really holding the tree grounded are the roots. So I think that's true about an individual also. Today, people may know me as Dr. Taral Nagda, Pediatric Orthopedic Surgeon, and you gave a fabulous introduction. But for me, what I am is are my roots and my groundedness, and that will never change.
So, spoken like a true farmer or an environmentalist, isn't it? So, there's another side to you. Tell us about Suma Forest and what was the idea behind it.
So, Chanda, like many things in my life, like being a doctor, falling in love, uh, getting married,
To the
this
person you loved.
absolutely. This was also accidental. It happened purely by accident. I think most good things in life happen by accident, and this was one of them. So we had a patient from a place near Nashik at Trambakeshwar. His son we were treating, and he just during conversation mentioned that doctor तुम्ही आमच्या गावी या. We have a beautiful village on a lake, and if you're passing by to Nashik, just drop over. And I did drop over to the village on a conference at Nashik, and I was mesmerized. I also remember that time on her first wedding anniversary, I asked Punita what would she like to have as a gift, and she said, "I want an island," and which we could never afford, and I could never dream of it. But then I saw this place, and I thought that this is something which we need to gift ourselves.
Okay.
By nature, everyone wants to live in places which are close to nature, where there are birds, you can see a sunrise, gentle wind flowing, where you can be close to rains and clouds and water. In Bombay, we cannot do that. But always your mind is attracted and your soul is attracted to such places. So I sort of managed to get booking for the place. I gave a token and took Punita. That place was perfect, on a lake. It had hills around, sky. There was only one problem. It was a barren land with only one tree on the land.
So, when you saw it, how did you visualize it even?
No, I did not visualize, but Punita had a lot of questions. That what is this and what are we going to do with it?
Or did she ask, this is not the island I spoke
No,
about?
absolutely. So she was also already working with a group called Urban Leaves and was exposed to permaculture and
What
slow
culture?
permaculture. So it's not even organic farming; it is self-sustaining uh, agriculture or creating a food forest. So we started working on it. Getting organic matter, uh, mulching the land, making it green one step at a time. Uh, no chemicals, no fertilizers, and it worked. And slowly that land from 1914, where it was just one tree farm, grew into a food forest which we see today. And that's Suma, the forest space, where we have now the birds, the butterflies, the trees, the shrubs, and we also have children who come there for a nature living experience.
So, do you have farm produce as well there?
So we have farm produce, but unlike the farms, these produces are now not for us only. They are also for birds. They are for nature. Some of the products which go back into soil to make it fertile, and some of it also comes to us.
So, you've like kind of concised it in less than a minute, but I'm sure it has taken you many, many years, a lot of effort, many hours, weekends gone. How was that journey? Did you ever give up? Say, ये तो नहीं हो सकता है. कैसे किया आप लोगों ने?
So there were two people. Always you require two wheels to run a wagon. So Punita was the one who was optimistic, driving force, and I was the supporting role in this whole journey. But what we also feel is that for a couple, a doctor couple, whose children are not now grown up, they are not living with you, they are in some other country, suddenly you feel a vacuum in life. And a common goal, a common activity, a common thing to do is something which uh, bonds them together again. And for us, it was this Suma, the food forest. going there, uh, planting new trees, looking after the old ones, smiling when a chili comes, or when a white jamun would show up, or when there are little buds of mango which will come. So, all those things really enriched our lives.
How many trees would be there?
We never counted. You never count your blessings. So,
Yeah, that's true. So, what do you love the most about what you do? You have so many facets to yourself. What do you love the most?
I love being in the moment, and at different times, there are different things you would do. When I'm in the operation theater, I'll enjoy doing the surgeries. When I'm with patients, children, I love chatting with them, talking to them about other things besides what issues they have. Um, I love walking, and I love talking. And of course, like photography. We love traveling, and also being on the farm. So there are number of things I love doing. So yeah, I'm not uh, dedicated to one particular uh, person or a hobby, but whatever makes me happy at that moment, I will do.
That's so nice. I have so many doctors I know who say that when they are in the operation theater, it's their meditation. So that's all they want to know and want to do. But it's so wonderful to meet someone like you who's got so many varied interests and I think the passion to follow them and see them through. But in 2021, you had a severe and a major accident. And I know of a lot of your doctor friends around you who probably thought that you may not be able to move anymore. But here we are. So tell us, how was that experience and what did that teach you?
So I think in life everything comes with a purpose, and this accident which we had, me and Punita both were involved in that, which happened in 21 during COVID times, and I had a spinal fracture, because of which I was in hospital for almost 4 to 5 months. I couldn't move, but uh, I think that's a time when I decided to surrender to whatever was happening, in a sense that accept whatever is happening and do your best with a smiling face in those circumstances.
That's very difficult to do, you know.
It was very easy to do. The moment you surrender uh, to the situation, all your worries go away, your expectations go away, and you want to make the best out of the moment. So there was a time when there was nobody in my room because of COVID, in the hospital room. And these are the times where I had all the time in the world to watch movies, to read books, to do things which I could never do as a busy doctor. So there was a plus side to it. It also got me more organized um, um, in my work. So uh, these are the times where uh, I could see a different facet of my life. As doctors, we see only one side of a disease, which is the person who is treating. Here I was on the other side. And being on the other side, I feel it made me a better doctor. If you are a chef, you are in the kitchen all the time, you see just one side of entertaining or running a restaurant. When you become a customer, suddenly you realize that you are on the other side. And being on the other side helps you to look at life at multiple angles. And I feel uh, that this experience made me a better person.
But you have to have a very strong mindset to be able to think like that. So, what was going on in your mind at that time?
Actually, there was nothing going on in my mind at that time. I also believe that to overcome such crisis or downward events in your life, I don't think willpower, strong mindset, hard work, these are not enough to overcome these challenges. What you just require is a still mind and surrendering to what is happening, believing in a major force and believing that he is going to be always behind you, whatever happens, and doing your best, giving your best at those times. And I'm sure in any such situations, if you are with that mindset, I think time will heal everything, and then you can overcome such situations.
Is there a spiritual side to you?
I don't believe in a particular religion or a god, but I do believe in the superpower. And what I feel that spirituality doesn't come naturally to everybody, but one needs to be trained. As you need to be trained to become a doctor, you need to be trained to become an engineer. We have a sound artist here, and I'm sure somebody needs to be trained to become a sound artist. Similarly, spirituality doesn't come naturally to everybody, uh, and it needs to be cultivated. For me, during COVID time, sincerely practicing yoga, with Punita and the teachers whom we have online, uh, was a training period which allowed me to look at me besides my body. And I think for people, what I want to say is, younger you get into such practices, the better human beings you will become and more resilient you will become. So, doing yoga is not just for fitness, it is not for having just a stronger body, but it is also for having a stronger mind and a soul which is more stable. So,
That's spirituality.
that is spirituality for me.
So, talking about resilience, you even did consultations on a wheelchair. So, how was that phase? What did the patients look up to you and say, and what was the entire, the feedback that you got, or the way you treated, was it any different?
So, consulting on a wheelchair, it happened because Dr. Ajay Thakkar, who uh, is my mentor, he is the CEO of Jupiter Hospital. He once visited me and he told me, Taral, from tomorrow, you have to start consulting. I said, how do I do? I am an admitted patient. He said, no, you go on a wheelchair, just attend the OPD because your patients need you. This worked like magic for me because I feel that for patients, they had the doctor back, they could talk to me, they could address their problems. I also, slowly started performing surgeries on a wheelchair.
Oh,
And there were parents who believed that even on wheelchair, my hands could work and my head could think, and I could do as good a job as when I was, walking and on my feet. For me, it meant something which was completely different. Suddenly, I found purpose in my healing, purpose in my recovery, purpose in my rehabilitation. And this is something I want to share with all the readers, all the listeners who are here, that if you have a disease and you are recovering from it, you add a purpose to it, and suddenly the rate of recovery will be different. Magic will start happening. And we see it in children all the time that a child is not well, has an injury, but he has a tennis match which is happening 10 days later. Suddenly the ankle pain will vanish, and the healing takes place at a different rate. So I think if there is a purpose, the disease will heal very fast.
I think just thinking that there is a reason why this is happening and there's a reason why God is taking care of you is purpose enough. And I think somewhere, when you said purpose, I would want to link it to a different aspect of life now. So, to achieve all that you've done, not only in your career, but with Suma Forest, with the fact that you love technology and you like to teach people about it, having your own farm, etc. All of this requires a medium, a facilitator. And that facilitator, to some extent, is money, right? We believe as financial coaches that for anything in life, you need to give purpose to your money, right? So, if I were to ask you, Dr. Taral, how did you take your financial decisions? Did you always think about purpose earlier or it came much later in your life?
Yeah. So I had different relationship to money throughout my life. That is what I feel. When I was a child, we were taught to conserve every rupee and save, because there was not much money. Your parents earn less than what was required, and there was always a struggle. I have seen my mother, working and making you know juice concentrates and making food at home to supplement my father's income. And me, my brother, all of us supported that, because uh, the relationship to money was very different. It was something which was past. Then when I became doctor and started practicing, some money started coming, but the need to buy a comfortable house, to have holidays for my children, putting them to good school was more. So we could never save. So there was never a habit of saving. It only came later on. In fact, I would owe this to MFA to put a method into the financial practice. I suddenly realized that as we do pre-operative planning for a surgery, a pre-operative financial planning for life is also essential. I never realized that you when you are earning and then we have expenditure, there are short-term goals and long-term goals. Just like treating a patient, we have short-term and long-term goals. Even financial planning will have short-term and long-term goals. But during my accident, I realized that what we plan for are good things in life. We plan for children's education. We plan for their marriages. We plan for holidays. We plan for making a larger flat. We plan to buy a good car. We never plan for difficult times. We never plan money for COVID. We never plan money for accidents. We never plan money if one of the earning members suddenly passes away. And it's very important to plan, that's why, for good time as well as bad times. And only when you plan, you are free of tensions. So this is something I realize. And what I now feel is, like how you said, surgery is like meditation. Even financial planning has to be like meditation. It has to be a balanced planning. It has to be a stress-free planning. And when you plan, it suddenly frees you from attachment to money, because you're never afraid of money or finances any longer if you planned everything well. So that's our relationship to money now, that suddenly that attachment to money has gone, because now we know where it's going to come from and where it's going to go. So that is something which is I want to share, that very good planning and providing for good times and bad times both, is really essential.
So, what would you say this entire process of planning for your goals and giving purpose to your money, what kind of feeling does it give you now? What would you equate it to?
Puts into financial nirvana,
Oh, lovely.
where your relationship to money becomes detached.
Yeah.
It's coming from somewhere and going somewhere, but you're not affected by it. If the market goes up, you're not affected. If it falls, you're not affected, because you know that you've planned for your good days and bad days.
Correct. So, you know your goals will be achieved. So, I have a rapid fire for you. Give me one word for the words that I'm going to say out to you. Okay.
Okay.
What does it mean to you? Okay. Happiness,
Bliss,
money,
nirvana,
life,
smile,
coach.
strict.
That's MFA. Your next goal.
So I think one word or one sentence.
One sentence, one word. Go for it.
So the next goal is to have life which is organic, where I don't have to set any goals and do planning, but just set it free, uh, you know, uh, to a path of happiness. That's the goal now.
Mm.
Go with the flow.
And what are the values that your kids have?
I know that definitely they are the ones who want to help others. Uh, they are focused in their work, and they are good human beings.
And with respect to money?
So they have uh, limited needs, and they will be financially independent, not dependent on their parents.
So the culture of planning for their goals has been, or the values of planning for your goals has been embedded in them too.
Yeah, so I know that they are much more organized and than what I was at their age, and this is something which I'm happy to see.
Which brings me to my next and the last question, Dr. Nagda. If you could go back in time, what advice would you give to your younger self?
I'm very happy with the way life has been, and it couldn't have been any better. Absolutely. But if I have to go back and advise myself, I think there are few things I would like to change about myself. One of them is to dry the towel after having bath, to remember the switches in the house, to keep back the bottle of water after drinking back into the refrigerator, and learn to, every time I have food, wash the dishes, and make life easier for people around me.
To be a better husband.
Absolutely.
Now, here you can add a bit also for doctors. So, from a doctor's angle, if you were to give some bits of advice to the younger doctors, what it would be?
So, if I was to advise the younger colleagues today, what I would tell them is don't be in hurry to start your practice and earn money, but to train yourself uh, very well before you start your practice. Go and learn the science, the techniques, and also the art and soul of medicine from the top people in the field. Work with them for some time. It's also important, I feel, people learn to balance their lives from the beginning. It never happens that you will say that for 40 years I'm going to slog like an ass and then I will enjoy life. Everything in life happens simultaneously. You know, the movie is being watched, you're having popcorns, at the same time you are attending to patient calls and being with family. Everything happens together. There are no compartments in life. So do everything in life what you want to do at 60, at 20. It's just a process. You cannot compartmentalize.
It's so true because so many doctors we meet, they talk about how they've only seen their children horizontal because they're working 13 hours a day, 14 hours a day. They are not able to take vacation for more than a week because their patients are waiting for them, or the patients may go to someone else. So there are so many of these insecurities which you are saying ki do not be and just live life as it comes.
I'm very happy for the younger generation because I see them being more balanced than their senior counterparts. Yes. So they have hobbies. I see a lot of young doctors doing music. There are doctors who paint, doctors who run marathons, and they look after their families, spend time with their children, and
They have many doctors have
spouse.
their own musical
Absolutely.
groups.
Yeah. And they invest better than their senior
Then
counterparts.
so in terms of financial acumen, what would you tell the younger side?
There are two type of doctors, one who have a financial acumen and one those who don't have. For those who have a financial acumen, it's easy, but large number of doctors don't have a financial acumen. And the advice is very simple. Absolutely. When you deal with a patient and patients start taking their own decision, we often tell them that I'm your doctor, let me decide what is good for your patient. Similarly, as far as financial decisions and acumen are concerned, doctors should have knowledge and interest. But I think execution, they should leave it to a financial expert. Uh, for a good long-term uh, uh, appreciation of your money and to have your money work for you rather than you working for money.
Also, could you add a line about doctors starting early? Because when you start off, you think you have no money. So most young doctors, we've seen their constraint is, I can't invest, I'm hardly saving anything. But we always tell them, even if you're saving 5 or 10,000, the compounding will work. Can you add something about that?
So as physicians, we believe in early intervention, and to to treat a disease well, it's important that we diagnose it early and treat it promptly. The same thing is true about financial discipline and financial practices. And I often tell my residents now that, of course, I will teach you the art of treating children with orthopedic problems, but I also want to teach you that from whatever you're earning, start saving from the time you start earning. Because obviously there are principles of compounding, but it also sets in a habit uh, of financial discipline from very young age, and which is very important for especially for doctors, because these are some of the things which are not taught in medical colleges.
Correct, absolutely. Thank you so much for sharing all that you know and everything about your personal as well as professional life. It's been wonderful to have you here. Thank you so much, Doctor.
No, I really want to thank you, Chanda, and MFA and everybody who's here, because for me, this is a flashback. Going back into all right and wrong decisions I've taken. And also, this is a platform where I can share something beyond my diagnosis and treatment management. And I'm sure a lot of people who are watching this would like this and benefit. Thank you.
Thank you so much.